Hello everybody, I'm delighted to welcome you to this special product live session, and today we're coming live to you from Wound Care Today in Milton Keynes. I'm here with Nina Burdiak from Mölnlycke to talk to you about the Mölnlycke Wound Support app. So let's start off with the basics. Nina, welcome. Thank you for being with us here today. Tell us about the app. What is it?
Thank you, Ali. Thank you for having me. So the Mölnlycke Wound Support app is a new mobile app aimed at clinicians to support consistent and accurate wound assessment. It also contains an education section also.
And I believe we've got a short video to
We
tell us all
have.
about it.
We have a short video which will give us a really good overview.
Assessing a wound to find the right treatment and product can be a challenging task. Every patient is unique, and several variables affect your decision. That's why we developed Molnlycke Wound Support, a mobile app to help you in wound assessment and assist in choosing the right product for a specific wound. Optimized to be used in your daily work, the app is easy to use and designed to support your decisions. Everything to help aid better patient outcomes. Here's how it works. Enter the wound characteristics through guided, intuitive selecting. At the end, you will be asked to take a photo of the wound. Based on your input, generated measurements will support your dressing selection, as well as provide uniquely chosen treatment considerations. Finally, you will be able to browse the recommended Molnlycke products, receive valuable guidance, and export a comprehensive summary based on the assessed wound. Use the Molnlycke Wound Support app, experience the benefits, and improve patient outcomes today. Get more information at molnlycke.com/wound-support.
So Nina, who is the wound care app aimed at and why?
So it's aimed at generalist nurses, so the non-wound care specialist nurses, the HCPs who are finding themselves becoming more and more responsible for wound management, and the idea is that it supports them through the wound assessment process and empowers them to make the right decisions for the patients at the right time.
It's much needed, isn't it, out in practice today? Everybody's so busy, and anything that will support. And then the specialist nurses, TVNs such as myself, is there benefits for us too?
Absolutely. So for TVNs, especially those who are leading teams, the app has a really good reporting suite in the back end, which enables them to see how well implemented and uptaken the app is, so they can ensure that all members of their team are using it. And I think the importance of it being used throughout the teams is it provides that consistency and continuity of care, because we know that patients are being seen by different HCPs, they're not always seen by the same nurse, so it supports in the consistent documentation as well to enable that really smooth patient journey and that patient going through its healing process.
Yeah, sounds great. And you know, is it easy to use? Is it complicated? How is it practically?
So it was designed to be incredibly simple and intuitive, and we can actually walk through the workflow, and I can talk you through the steps that you take. So when you log on to the app, you're greeted with a start screen, and you can choose to go directly into the wound assessment workflow or go into the knowledge base section, which is an area that contains information around wound etiology, product information, other clinical factors that are pertinent. So if we start by going down the wound assessment flow, you start by deciding whether to take a photo of the wound at the start of the assessment or at the end of the assessment. And this functionality is actually really important, and it came from direct feedback from nurses in the UK that actually it's important to be able to choose when to take the photo, because sometimes taking the photo first means that they can then make the patient comfortable and continue with the wound assessment once the patient has been made to feel comfortable. But sometimes it suits the process better to do it at the end, so the flexibility is there. So you follow the guidance throughout the process, and the app guides you on how to take the photo. So you place the green measurement dot near the wound but not touching the wound, and this measurement dot helps ensure that the wound is measured accurately. It gives a bit of context for the app to take the accurate measurements. So once you have made sure you're happy that the wound and the dot are centered in the phone's camera settings, you then take the picture. And what the app will then do is highlight in green the perimeter of the wound so that you can be confident as a clinician that it's going to be measuring what you're seeing with your eyes. And you can see in this example that there is a small deviation from the wound edge. So this is an example of when you would want to retake the image, and it's usually something as simple as just moving position slightly so you improve the light and reduce the shadowing, and that overcomes the issue that you see there. So really simple. So the next step is to select where on the body the wound is located. So pretty self-explanatory there. And then when you move into the next screen, you use your finger to drag the dot to highlight exactly on the body, on which plane of the body that it is on, and then you continue. So further stages then include selecting the wound category, so the wound type, whether it's a pressure ulcer, a DFU, a VLU, for example, describing the levels of exudate, whether there's none, low, medium, high or very high. And it also will get you to assess the peri-wound condition of the skin around the wound. You will also at this point choose whether or not there is a cavity present through a yes or no, and whether antimicrobial therapy is indicated. You'll be able to select that at this point as well. So once you have completed the assessment, the measurement of the wound is then generated, and this section is designed to help you select the most appropriate dressing size by giving you the circumference as well as the width and the length, for example, of the wound as well.
And wound measurement it's very subjective, isn't it, out in clinical practice? And there could be 5 of us in a room and we would all get a different measurement, you know, by using like a rule that you get in the dressing pack. So, you know, we've gone away from putting the grids onto wounds where we count the squares. Infection control is an issue and things like that. But how accurate is this at measuring?
Absolutely, and I think the issues you've just highlighted around infection control and accuracy are really, really pertinent, and this app is designed to alleviate those challenges. Because it uses artificial intelligence, it is very, very accurate. Using the dot marker, it has an absolute reference point to then generate an incredibly accurate measurement of the circumference and the width and the length of the wound also. And in the pilot testing that we did before we launched the app, where we compared the manual measurement versus the app's measurements, it was proven to be very, very accurate and obviously avoids the human error element, and there's no need to touch the wound. So from an infection control perspective, it's very, very beneficial. So the app then highlights the considerations for the clinician after the measurement has taken place. And what this means is that if, for example, you have assessed a pressure ulcer and it's a pressure ulcer maybe on a heel, it will suggest that you consider offloading protocols as well. So it will give guidance, and throughout the process you can expand on all of the information points to learn more, whether it's at the point at which you're trying to select what wound type it is, or the exudate levels, or the product selection, for example, which we'll come on to. So at the end of the assessment, it generates a summary of all of the information that's been populated. And the output from there is a PDF document that can be emailed or printed and added to the patient record. So whether or not you have electronic or paper-based records, you've got the functionality within the app to accommodate that, so you can email it and then attach it to the patient record, or you can print it out and add it into a paper-based record. And I think the important thing to mention at this point is the app does not store any information. At the point at which the PDF is generated and it has been saved down into your systems, it's gone from the app. At no point does the app record any identifiable patient information whatsoever, which is really important because it means that it doesn't have to involve any IT input from trusts or organisations, and it's really quick to get started with.
So are there any other benefits to the app that we need to know about? It does so much, it's educational, it's measuring, quality improvement and all these things. Is there anything else we need to know?
Yeah, so absolutely. I touched on previously about the knowledge base area of the app, and what that does is give really clear and pertinent clinical information to support the decision-making process and also upskill the knowledge and experiences of the nurses as they're using the app. I touched on the reporting element as well from the app, and that gives really good insight and captures the incidences of different wound types without any kind of identifiable patient data. So it really helps from an audit perspective monitor patient populations and things like that. And of course, one of the main benefits is it's completely free of charge to use. There is no restriction on who can use it from an HCP perspective, and you don't need to have Mölnlycke products on formulary either. So we really wanted to make it accessible to all to support the generalist population of nurses.
And we need to be using more digitalisation in the NHS. We know that, so it's a real good step forward. It sounds like obviously as a company you're working on that to improve it greatly as well down the line. So how can people access it? How can we get hold of it? How can we use it?
So it's really, really simple. You would just go to your app store, whether it's on iOS or Android, and download it. You search for Mölnlycke Wound Support and you download it. And as I said, it's free of charge, so you can download it onto your device, whether it's your phone or your tablet. It's free of charge, but all you do need is an activation code. And the activation code can be obtained from your Mölnlycke representative or by emailing info.uk@mölnlycke.com.
Sounds absolutely amazing, and I'm sure people will be on the website now and they'll be wanting to get hold of it and download it and to try and use it in practice, so that's great. Thank you so much, Nina, for sharing your time with us today, and thank you for watching, and we hope you can join us again for our next Facebook Live events.